we'll jump into how some of those trends we see affecting you as a distributor, and in a lot of connotation, it might be seen as negative or burdensome, but the generics and drug proliferation actually will allow us to focus. Jeffrey Moore, author of several books, one of which is definitely a favorite of mine, the best-selling Crossing the Chasm, coined the term the long tail 15 years ago. The drug proliferation has definitely created a longer tail. It means that you have to stock more SKUs. The 115,000 different preparations that are available out there, you're carrying some subset of that. That means that you have a higher average cost per SKU. You have a lower velocity or turnover of the average SKU, which erodes your margins, moving more products for same or less money. And the added cost or complexity of using third parties, whether it's master distributors or you're distributing to the big three or from the big three, you'll find the need for EDI or other previously unnecessary supply chain visibility and technology infrastructure. All contribute to underperforming inventory and higher costs, while your customers' expectations remain the same or even increase. According to Adam Fine in May Modern Distribution Management article, most wholesaler revenues are linked most closely to sales of brand name drugs. The majority of wholesaler profits come from generic drugs. Pressure on pharmacy profits from generic drugs is rising as payers learn more about channel economics. They implement new payment benchmarks and use novel cost-plus contracting strategies. The retail prescription price war launched by Walmart also threatens the overall profitability of generic prescriptions for pharmacies. The drug wholesalers will face margin pressure on generic drug sales because pharmacies will be more price sensitive, require bigger discounts. Generic programs are shifting retail market share away from wholesaler supply dispensing channels into self-warehousing retailers. Government agencies are also questioning the profits that the distribution channel earns from generic injectable drugs. PwC predicted their 6 trends back in March of 2011 that the pharmaceutical supply chain will undergo 3 key changes over the next decade. It will become fragmented with different models for different product types and patient segments. It will become a means of market differentiation and source of economic value, and it will become a two-way street with information flowing upstream to drive the downstream flow of products and services, and the management of information transferred between the pharma company, the patient, the healthcare provider will all become important with the movement